All right, guys, so I want to talk about some upper body, shoulder, neck, upper back pain because I've heard a lot of people that have come to me not only recently but over time that tell me that they just had this aching or numbness or tingling or just stiffness, and therefore it becomes pain, it becomes chronic in their shoulder or in their neck. And what happens is it causes more issues and more pain, and it limits your training. It limits your ability to train. It limits your ability to lift heavier weights and progress in your training and your workouts. So we want to get to the bottom of what is causing this upper body and neck pain, why you're having it, and what you can do to fix it. So first off, it always comes back to posture and how we're standing, how we're going about our day. So it's not just what we're doing in our workouts and during our training sessions, but it's what we're doing outside of there. So if somebody comes to me and they tell me that they have some chronic neck or shoulder pain, I might ask them, one, yes, did you have an injury? If you haven't had an injury, of course, if you have numbness and tingling and it's severe and you have weakness and you cannot move your shoulder, absolutely go to the doctor. I'm not trying to be a medical professional here, but if it's something that's mild, that's just limiting you little bits here and there, and it's getting worse, and it's possibly due to a combination of posture, mobility, and then overall strength. So when it comes to posture, we want to make sure that our head is in the right position, our torso, our ribs, everything is aligned properly. Our spine is in a proper natural curve, and that we're not laterally shifted and that we're not front to back shifted. So first off, if you were coming to me and you were asking me, to help you with this, I would assess your posture, both just standing and actually moving through exercises. Because if you're having a forward head drop, if your shoulders are rounded here, if you have tight hip flexors, all this can cause problems and pain, not just in your shoulder, but in future videos, I'll talk about some issues that you might have with either your back, hips, knees, or feet too. But the body works in conjunction with each other. So what happens in one area might be coming from or leading to issues in another area. So first off, assessing the posture. Next thing is making sure that your mobility is there, meaning not just your range of motion, not just static stretching and holding a position. I can possibly lift my arm up and get it all the way here, but the question is, when I start adding weights, do I have that same range of motion? Do I have that same ability and mobility during those exercises? I want to make sure that I can actually move through an exercise in the proper range of motion. So what can limit me with that is if I am extra tight. So what can cause neck and shoulder pain could be the fact that I am very tight in my shoulder, in my chest, because I'm so used to this improper posture. If we're sitting at a desk a lot, if we're sitting at a computer, if we're looking at our phones all the time, it causes us to be in this improper posture that we don't want. And therefore, the muscles that we want to work, those postural muscles, aren't worked. And even if we target those muscles, if we're too tight with the other opposing muscles, you won't be able to actually get as effective of a workout. You won't be able to stimulate the correct muscles for posture, for activation that you want to. So first off, we talked about posture. Second off, we talked about mobility. So how do you improve mobility? Not just static stretching. Sure, I can grab a strap, or I can, do some, chest stretches or doorway stretches. I can do all that stuff and just hold those stretches. But what I want to think about is also self-myofascial release, using either some kind of trigger point therapy. You can get a deep tissue massage, but if you don't have the ability, which not everybody has the ability to, especially right now with either massage therapists unavailable, working from home, things like that, you need alternatives. So self-myofascial release, SMR, or trigger point therapy is great. And there's a couple options. You can use a foam roller. This is a short one. They have long ones. I recommend long ones too. I don't have a tennis ball with me, but a tennis ball or lacrosse ball, excellent, because we want to roll out some of those trigger points in our back, in our upper back. We want to roll out some of the trigger points in our neck. We want to roll out and get in the points in our chest and our biceps tendon and our pecs too. And then this is my little cane, my TheraCane. And this is great for getting into those back places, so we can essentially get into those trigger points or those trigger spots, okay? And we want to start with getting into these trigger points, because then we can release the tight muscles, so then we can activate and use the right muscles that's going to help us get out of pain and improve our posture and improve our performance in and out of the gym. So this is not just about training in the gym. What you do in the gym correlates and helps you in the rest of your life, and what you do in the rest of your life is going to determine how your training progresses too. So they both go hand in hand. So a tennis ball is also a great means of doing some SMR and trigger point therapy. So once we release those tight muscles, and this happens in that same workout, and this happens regularly, you want to work on posture, you want to work on mobility and release, and then you want to work on activating and using the right muscles. And so what are the right muscles? We tend to overuse our chest and our front shoulders, anterior deltoids. We tend to underuse, meaning we want to work on strengthening our back, and we want to work on strengthening our posterior delts and our rotator cuff muscles. Rotator cuff muscles keep your shoulder in place. Posterior delts help you have better posture. Same with the teres, the rhomboids, the latissimus muscles, so all those back muscles. Those are also going to help you have a good posture, stand up tall, and then as they get stronger, then you can lift heavier weights. So things as simple as proper posture, proper form and technique of rows. We don't want to do rows where we're rounding our shoulders. So if you see somebody do a row and they round their shoulders here, and they're just pulling those elbows back as far as they can, you're not actually working your back. You're working your neck and your traps, because you're so limited in that range of motion. So what we want to do for our rows is properly pull back so that we're engaging our back, okay? And this all might take a little bit of regression. I highly recommend talking to a personal trainer or coach. I can definitely help you with this, both in one-on-one, group training, and virtual training. If you have any questions, we definitely want to get you out of pain and keep you out of pain. So this is something that's not going to happen on the first time that you work with me or the first session. This has to be part of your regular routine. Keeping proper posture, we might have to adjust something that you're doing on a daily basis, and how you're working or how you're going about your day, so that you're not triggering and activating the wrong muscles and tightening up your body in the wrong ways. So posture, mobility, definitely releasing those tight muscles, activating the right ones. This is all going to help you so that you're out of pain, especially in the upper body, shoulder, neck, and trap area. If you guys have any questions, make sure you reach out to me. Send me a message, fusionfitgym@gmail.com. Have a good one, everybody.